Mr. Mjiri, and let me welcome you all to this press briefing. I hope I will be very clear so that at the end there may be no questions. Thank you for joining us today. We are excited to share with you the remarkable progress and milestones that the Ministry of Health and Child Care has achieved, both in the past and present. Today we focus on the success stories that highlight our collective efforts to transform the health sector. The health sector continues to serve as a cornerstone in driving Zimbabwe's national development agenda. Through the health and well-being thematic area of National Development Strategy 1, we have made significant strides in improving health care access and outcomes across the country. Several key health indicators have shown notable improvement, and we can confidently say that our healthcare system is on the right track. We are particularly proud of the advancements in areas like maternal and child health, disease prevention, and healthcare infrastructure. Looking ahead, we remain fully committed to our shared vision of increasing access to quality health care for all Zimbabweans. Our goal is to ensure that every Zimbabwean, regardless of where they live, has access to affordable, quality healthcare services. While we continue to celebrate these achievements, we also acknowledge the challenges that remain. However, we are resolute in our belief that the gains we have made will serve as the foundation to overcome these challenges as we work together towards Vision 2023. I will start on health status and service delivery. We use life expectancy at birth as a measure, and this has increased from 61 years to an average of 65 years, and to as high as 68 years for women. On maternal and under 5 mortality rates, there's been a declining trend since 2010. For instance, the maternal mortality declined from 525 maternal deaths per 100,000 live births in 2012 to 363 per 100 live births in 2022, according to the Zimbabwe Population Census report. We are not very happy with this figure. Although there's a decline, we would want to see it going down to a 2-digit figure. The under 5 mortality rate decreased from 39.8 deaths per 1,000 live births. However, institutional maternal and neonatal deaths are still unacceptably high. On HIV and AIDS, Zimbabwe has surpassed the 95-95-95 uni-AIDS targets, with 95% of people living with HIV knowing their status, more than 95% of those being on antiretroviral therapy, and 95% on ART being virally suppressed. On TB incidence, this has drastically declined, and Zimbabwe has been removed from the list of countries with highest burden of TB. And on malaria incidence, this has declined from 16 per 1,000 cases in 2023 to 2.4 per 1,000 in 2024. We also note improvement in non-communicable diseases. Though the non-communicable diseases are a significant health problem in Zimbabwe, there are numerous efforts to control and manage them. The country has accelerated the decentralization of NCDs to lower levels through World Health Package of Essential Non-Communicable Disease Interventions program. The country has comprehensive National Cancer Prevention and Control Program. Emergency preparedness and response, the ministry has continuously built capacity to effectively prepare and respond to disease outbreaks. The ministry managed to respond to a number of frequent and emerging disease outbreaks such as mpox, cholera. As of today, Zimbabwe has recorded 608 suspected cholera cases. Maybe I should say we had a cholera outbreak which ended last year but re-emerged in November last year. And as from November last year to date, that's when we are talking of 608 suspected cholera cases and 124 confirmed cases. Cumulatively, we have recorded 15 deaths from November last year. Mpox and measles. The country managed to control and contain the mpox and measles outbreaks. The health sector continues to battle the recurring cholera outbreaks countrywide. The lack of sustainability of existing wash services has been a major driver to waterborne diseases such as the current cholera outbreak. The ministry continues to institute interventions in health education, enhance the hygiene, setting up cholera treatment centers, and coordinating the multi-sectoral response. Public Health Emergency Operations Center. The ministry has a functional Public Health Emergency Operations Center both at national and sub-national levels to effectively coordinate public health emergencies using the incident management system. On clinical services, the ministry has managed to offer a wide range of clinical services at all platforms, that is, at community, primary, secondary, tertiary, and quaternary levels in both public and private settings. Specialized services are being offered in central hospitals. These include open heart surgery, which was introduced at Parinyatwa Hospital in June 2023, and 53 operations were successfully conducted. The plan is to do 50 operations every year. 600 cataract surgery operations were done last month at Parinyatwa Group of Hospitals. Pediatric cancer unit was established at Parinyatwa. Hematological cancer unit at Parinyatwa. Pediatric orthopedic hospital at UBH in Bulawayo, and centers of excellence for HIV care and treatment at Mpilo and Parinyatwa. Other specialist services such as hip replacement, neurosurgery, etc. are also being done. We also look at rehabilitation services. The ministry has expanded intensive therapy for children with cerebral palsy to 5 stations, that is Chitungwiza Central Hospital, Masvingo, Victoria Chitepo, Gweru, and Chinoi Provincial Hospitals. On our health workforce, the country has successfully launched the Health Workforce Strategy and its investment compact, aimed at doubling the current health workforce by 2030. The Health Service Commission was established in 2023 to address health workforce challenges. The ministry has increased the number of nurse training institutions. This has resulted in the increase of admissions into nurse training schools, with an expected increase in outputs from 2027 onwards. Admission into training programs was 4,570 in 2024 against a target of 4,724. So we are not that far from our target. Pharmacy technician training intakes were doubled in 2025. New training programs for advanced care were introduced. These include accidents and emergency care course at Mpilo, biomedical technology training both at ministry and university level. New medical training institutions have increased, with Great Zimbabwe University being the latest addition. Staff attrition rates have reduced compared with the post-COVID-19 era. On medicines and sundries, the country requires approximately 17 million worth of medicines monthly. The figure only covers the most essential medicines. The availability of essential medicines increased from 22% in 2023 to around 50% by the end of 2024. The increase in availability has largely been due to increased investment in medicines. For instance, currently, there are two main medicines supply contracts, namely Intrapharma, which has got a contract of around 24 million, and Clean Planet around 17 million. There were a bit of challenges in delivering medicines during the beginning of the year, but currently the medicines are flowing in and they are being received at Mtare Nut Farm facility. In 2025, government committed about 44 million towards medicines, and we are still in discussions with Minister of Finance so that this figure can be increased during the mid-term review of the budget. There are ongoing negotiations with Treasury to increase budget allocation to health in view of the dwindling external support. On infrastructure, a number of existing facilities were renovated and new ones constructed around the country. These are at Manyame and Lupani hospitals, which are under construction, Stone Ridge and Cowdrey Park in Harare and Bulawayo, which were completed, and Towood Hospital in Kwekwe, where renovations have just been completed. We have new sites for construction at Manize Health Center in Chivu, Rudanda Health Center in Zaka, Lady Stanley Health Center in Bulilima, and Paradza Health Center in Chivi South. We also have Nut Farm new national warehouse, which was completed, and the Mtare Nut Farm warehouse, which has just been completed and is now operational. Additionally, the Mashingo Nut Farm facility has officially opened and is fully functional. Solar for Health projects were completed at more than 1,000 facilities. These are mainly clinics in the rural setups. We had also a borehole project where we saw more than 450 boreholes being drilled at different health facilities in all the provinces. Additional new clinics were opened in both public and private sector. On medical equipment, efforts were made to re-equip clinics and hospitals throughout the country to improve service delivery. New theater equipment was installed in more than 60 secondary care facilities. 20 digital X-ray machines were installed. New MRI scans were installed at Mpilo and Parinyatwa Hospital. 3 central hospitals and 2 provincial hospitals now have CT scan machines. Additional CT scans machines are being procured to cover other facilities. On radiotherapy services, radiotherapy centers at Parenyatwa and Mpilo are now fully functional after the machines, all the 5 machines were repaired. However, these old machines that have high maintenance costs, the ministry is in the process of acquiring new machines using the availed sugar tax funds. And I am happy to say the tender processes have been completed, and I'm sure by end of this next week we will be able to know the companies that are going to be supplying those machines. Status of dialysis equipment. Dialysis services are available at most central hospitals and some provincial hospitals. The ministry is engaging various suppliers and countries for placement of equipment, and the government will buy the required consumables. The supplier will take care of the equipment and hand over after an agreed period. This will take off the cost of maintenance from the Ministry of Health and Child Care. The ministry is also finalizing an agreement with an Iranian dialysis company, ICD, for supply of 70 dialysis machines. On transport services, the ministry managed to boost the healthcare fleet through procurement of additional ambulances and service vehicles, including staff vehicles. The ministry procured 27 staff buses to curb the transport challenges being faced by our employees in our institutions. The ministry recently acquired 183 vehicles for distribution of drugs and commodities to health facilities. The ministry also acquired 48 ICU ambulances, which were dispatched to districts. Furthermore, the country acquired air ambulances, 6 in all. The service is currently available for Harare and Bulawayo, where we have 2 air ambulances in Harare and 2 in Bulawayo, and we have just completed establishing 1 in Victoria Falls, which we are going to launch in due course. And work is going to commence to establish the 6th air ambulance services in Mutare. The country has established domestic health financing mechanisms, such as the National AIDS Trust Funds, to support national AIDS response. The initiative has been emulated by a number of countries. We have the Health Levy Fund, which is a levy on airtime and data to support health services, especially medicines, blood and dialysis. Also, the sugar tax was established, which is a levy on sugar-containing beverages, and this is to support health services, mostly on non-communicable diseases. And this fund is what we have used to purchase radiotherapy treatment machines. There's also tax on fast food, which was introduced during this last budget, which is levy on fast foods to minimize consumption of unhealthy foods. And there's been establishment and utilization of health service fund to complement the fiscus. Implementation of the user fees policy to safeguard vulnerable groups such as children, the elderly, disabled, pregnant women, the indigent, and those suffering from conditions of public health care, public health importance is also is work in progress. The ministry is expediting the establishment of a national health insurance scheme. A draft bill has already been done, and we expect to take it to Parliament by June this year. The ministry over time managed to engage and secure significant resources from development partners such as the Global Fund, the Health Resilient Fund, the US government and the UN family and others to support healthcare services. We were still waiting to see the final position on the US government on their review of their funding to us. Digital health and information and communication technology. The ministry has managed to keep pace with the rapid advancement in technology. To embrace the trends, the ministry has embarked on the following. It has introduced and scaled up implementation of the electronic health records, the district health management system as a central repository for all health information. It has introduced and scaled up the electronic logistics management information system to manage medicines and commodities. We are also working on telemedicine and hospital electronic management information systems. I thank you for your listening attentively.
Thank you.